into it. Wow, Cherie, what's going on? Putting your hand back down. I'm looking for this again. Okay, now I'm right on top of it. Tell me where it hurts.
Yeah, that's it. Ow.
Push down, push down, push down. Push down, push down, push down. Lift your head and yawn. Good. Push your head down. Lift your arm up, head up. Drop.
Oh, jeez.
And it's very sore. Drop it. Now, this is the fullest movement I've gotten so far. And that's that released the under tissue of the scapula, which is called subscapularis, and the accompanying soft tissue. Lift your arm up high. Drop. Latissimus dorsi. And I can finally feel the joint popping freely and moving outward. For me, the test is if the joint rotates. If the glenoid fossa rotates freely, then I know I have finally achieved my goal. So it's a combination of opening up the tissues, and I'm going to rotate slightly. Now I use rotational movement, and I ask the client to straighten your arm and push gently and turn your wrist, drop, and relax your arm. And I'm going to pull back slightly as I go. Relax your arm. And deep breath. And it's a retraining proposition. You're trying to retrain the joint. You're trying to retain these muscles. Now, again, I'm into this subscapular tissue. I'm going to hold both sides of it and pull your shoulder blades back. And push your head back a little. 1, 2. Lift your arm up high, head up high. Drop. Relax your hand. Relax your arm. And I'm rotating. Drop gently. Drop gently. Good. Drop gently. Drop gently. And as I push, I'm trying to push the joint back in position. I'm putting weight into the joint and putting it back in position, because if the joint's forward or the joint's backward, its joint is generally forward. If the joint is out of position, the nervous system is affected. And so oftentimes when you see these pecs that are pulling forward, you're actually, the cause is the pec. The cause is the pec. And if you don't resolve the pec problem, you're not going to resolve the rest of it. It is a defeating proposition. So getting this to move and release, the joint to open up and to move properly and balance in the glenoid fossa is the goal, okay? So straighten your arm out, Miss Cherie, and turn your wrist, drop, and relax. Now, there's still some compression because it's been there for a bit, and there's tissue that has to be regrown and has to be convinced to release further, and this quagmire here. Lift your hand up high, drop. So when you're releasing muscle tissue, drop. Lift your hand up high. Relax, deep breath. You ask people to breathe. You ask people to let go. And again, as I said, we're opening up not just muscle, we're opening up acupuncture, acupressure meridians, the Chinese meridians. Lift your hand up high. Drop. There it goes. Yes, good. Deep breath. Now, ironically, the chi moves through the blood, the lymph, and the joints. And so obviously if this joint is impaired, the chi is not flowing. So as this joint opens up, the chi begins to flow. The entire system of the body starts to function, and then the yangming, the blood energy flows. Releasing, letting it go. Straighten out. Drop. And relax. Now I can feel with my thumb and fingers, these muscles are starting to release. I can feel them going pop, pop, pop. These tight tissues are going looser and looser and looser. Drop it. And lift your arm up high. Drop. And relax. And the most important thing to realize is that this joint and the acromoid right up in here is also part of the joint. So if the acromoid is still tight, if it's still popping, that means that you have problems still with the subscapular tissue. So this is where we're going to stop, and we're going to start working on the subscapularis a little more. Okay?